everyone. Today we're going to check your vision, Brittany, with the Snellen chart. Okay, so do you wear corrective lenses, glasses, or contacts?
Contacts.
Do you have them in today?
Yes.
All right. So can you cover one eye for me and tell me the lowest line that you can see on this chart?
DEFPOTEC.
Perfect. All right, now can you cover the left eye? And what's the lowest line?
DEFPOTEC.
Okay, good. So with your corrective vision, you are 20/15 both eyes. Can you tell me what color this is?
Green.
And what color is this?
Red.
And which is the longer of the two?
The green.
The green one. Okay, so your depth of perception is good too. All right, so why don't you come take a seat and we're going to check your blood pressure. So do you know what? Actually, we're going to do your near vision. So if you just take a seat and I'm going to have you read. You can just read 3 or 4 words at 14 inches.
USA Swimming is the national governing body for the sport of swimming.
Okay, great. So your near vision is perfect. So this is going to be your blood pressure. So have you had this done before?
Yes.
All right, so you know it's going to get tight. Okay. So what I would do is feel for your brachial pulse. You've got a strong brachial and a strong radial. So I'm going to use the brachial and I'm going to palpate up to 30 millimeters of mercury until I can no longer feel the pulse. Okay? So you're going to feel pressure. Okay, so I can no longer hear it at 100. Okay, so now I'm going to use my stethoscope. So I will pump up to 130. Okay? Just going to get tight. Okay, great. So your blood pressure is 100/58. Alright, so now I'm going to check your skin. And I would say your skin tones are pinkish and even. I'm not seeing any rashes, bruises, or any lesions or scars. I'm going to check your skin turgor. Your skin turgor is good, so you're not dehydrated or anything. I'd say your temperature is warm and dry and equal. Next we're going to check your hair. Well, actually, you do have a little mole here, so I'm just going to measure it. Let's say it's 2 millimeters in diameter. It's slightly raised. It's brown in color. The color is equally distributed in it, and you can see the borders, no problem. Okay. Next I'm going to check your hair. Your hair is dark blonde in color. It looks nice and clean. Any tenderness? No. Let me check. I'm going to check. I'd say your hair was evenly distributed. I'm not seeing any bald patches or anything. Any itching anywhere? No. I'm not seeing any pediculosis or any nits. I'm not seeing any scars or lesions. Okay, I'd say your skull was normocephalic, and I'm not feeling any depressions. Okay. And your face, I'd say your head was upright. I'm not seeing any tics or tremors. Can you smile for me? Okay. I'd say your face is symmetrical. These facial features. And I would say that your head is in proportion to the rest of your body. Alright, your palpable fissures are symmetrical. Smile again. Your nasolabial folds are equal and symmetrical. Now I'm going to check your TMJ joint. So any tenderness? No. No. Can you clench your teeth for me? Check your temporal muscles and your Faceted muscles. Can you open and close? I'd say smooth range of motion. Just feeling a little bit of clicking right there. Can you go from side to side? And how about can you go forward? Keep going. Can you stick out your tongue? Okay, good, symmetrical. Now I'm going to check your eyes, and I'd say your eyes are aligned. They're not sunken or protruding. And I forgot to say on the face, I'm not seeing any excessive facial hair either. I'm going to check from the side. I'm going to check your corneas. Your corneas are nice and clear. I dim the lights, and I'm going to say your irises are a nice brown, nice and round, equal in colour. Your pupils are also equal. So I'm just going to shine the light into your eye, and I check both eyes equally. Look straight ahead for me. Okay, good. And your pupils react to light and accommodation. So if you can just look straight ahead for me and just follow my finger. Okay, and your eyes converge and your pupils constrict. So very good. Alright, so also for your eyes, I'm going to check the cranial nerves 7 and 12. So I want you to clench your eyes tight. Okay, good. I want you to frown. I want you to lift up your eyebrows. Equal. Can you puff out your cheeks? And can you stick out your tongue? Good. So your cranial nerves 7 and 12 are intact. I'm not seeing any eyelid drooping, no ptosis, and no strabismus, which is good. And to check the consensual response, I would use probably a cotton ball, and if I touched this eye, it should make this eye blink, the same consensual response. To check her peripheral vision, I do the confrontation test, which is checking cranial nerve 2. So if you can cover this eye for me, and let me know when you see my fingers.
I see them. I can see them. I can see them. I can see them.
Okay, good. And then the next one is the extraocular eye movement, the 6 cardinal fields of gaze. So if you can follow, I'm going to do a big, you can just follow my finger for me, okay? Without moving your head. Okay, perfect. Good job. All right, so I would also inspect and palpate the lacrimal duct, so I would use a glove and I would check each lacrimal duct equally. So I would palpate right here, any tenderness, and I would touch here.
No.
And I would be checking for excessive tearing. Next we're going to check the ears. So I'd say the ears were bean shaped. They're in alignment with the outer canthus of the eye and the upper part of the ear. I'd say the pinna recoils and the cartilage is nice and strong. Any tenderness when I lift up?
No.
Down? No. Good. I'm not seeing any drainage in the what part of the canal I can see. So now I'm going to inspect the ear. Okay, and I'd say the ear was the same complexion as the rest of her skin. I'm just seeing a little bit of wax, some fine vellus hair, cone of light. I can see the bony prominences, and you have a nice flat, pearly grey tympanic membrane. Great. So next we're going to have to check So there's 3 different tests we're going to do. We're going to do a whisper test, a Weber test, and a Rhine test. Okay. So if you can block this ear for me, and let me know what 3 words I say.
Cat, dog, fish.
Okay, perfect. Next, I'm going to use a 512 tuning fork. So I'm going to place it on the top of your head and let me know if you can hear it in both ears. Okay?
I can hear it in both ears.
Great. All right, then the next test is the Rhine test. So I'm going to place this on your mastoid bone. Let me know when you can no longer hear the sound. And then I'm going to place it about 1 to 2 centimeters in front of your auditory canal. And then tell me when you can no longer hear that sound. Okay? You ready?
I can hear it. I can hear it.
Okay, good. So that means she can hear the air conduction twice as long as she can hear the bone conduction. So it's 2 to 1, which is great. Next, I would check her nose. I'd say that her nose is midline. I'd check the sinuses, any pressure, any discomfort when I'm pressing. No? Okay, good. I'd say I don't see any drainage. I'm just going to take a look. I see some fine villous hair. The nasal septum is intact. I'm not seeing any deviation. I'm going to check for patency. So if you can just block one nostril and sniff, and then block the other and sniff. Okay, so on both nasal passages are clear and intact. Great. Then I'm going to check your frontal and your maxillary sinuses. So let me know if there's any tenderness. Any discomfort? All right, then we move on to your mouth. So let's say your lips are nice and pink and even. If you can open up for me. Open up nice and wide. And I would normally use a tongue depressor and really check her mucosa, which is nice and pink and moist. If you can open up nice and wide and say ah. So uvula is midline, it's dangling. I'd say your tonsils were a +1. If you can stick out your tongue for me. So your tongue is midline, slightly rough, which is normal. Can I check your teeth? Your teeth are nice and white, they're in good repair. Open up. I'm not seeing any missing teeth. And then check your gums. Your gums are nice and pink. They're nicely attached to your teeth. And the gingiva. No cavities, no bad odor. Your gingiva is firmly attached. Can I just check the roof of your mouth, the hard palate? It's like a whitish color. And then your soft palate is nice and pink and moist. I'm not seeing any petechiae or anything. And can you swallow for me? Alright, next we're going to inspect your neck. Okay, is there any discomfort?
No.
Okay, good. I'd say your skin tones are even. No lesions or excessive hair. I'm not seeing any scars. I'm not seeing a goiter. Now we're going to palpate your nose. So I palpate on both sides. So your pre-auricular is in front of the ear. Your posterior auricular is right behind your ear. Your tonsillar, then your submandibular, and then the submental. They're all non-palpable. Then your superficial, anterior superficial scapular, and then your posterior scapular, and then your occipital. I'm able to palpate those. And then here's your clavicle. So if you can just bend your head this side and slightly tilt it down a little bit. Okay, and your supraclavicular, that's kind of above your clavicle right here. And then your infra, just tilt it down a little bit. Infraclavicular. Okay, good. I'm feeling that. Alright, and then your trach. I'd say it's midline, there's no deviation. Then I'm going to palpate your thyroid. So if you can swallow for me. So it rises and then it falls back to its normal position. So if you can just move your head that way. Okay, and then move your head the other way. So I'm unable to feel the borders of the thyroid gland. Okay, and then let's just check your head for range of motion. So if you can put your chin to your chest for me, and then put your head all the way back, and then laterally from side to side. Any discomfort? No. And then I'm going to check your strength. So if you can push my hand away, and again this way, and then this way, push down, and push back. Right, good. So I'd say your muscle strength was a +5. And that is it for this part of the assessment.